Hello, I'm Stephan Schwartz. This week I want to talk about something that has emerged as I have been doing research on COVID. So many millions have died from this disease. I think when medical historians look back on the COVID-19 pandemic, years after the pain and the suffering and the death have faded from the immediate emotions, I think now that I have been doing this research, I think what's going to stand out for them above all else is the grotesque financials of this pandemic. Nobody talks about it. You never hear anybody on media. You don't see it in print. But when I dug into this, which is what I've been doing for the last few weeks, what came out just astonished me. So just a little history, a little background to get started. The COVID pandemic began with a Washington state resident who had returned from Wuhan, China on the 15th of January, 2020. He is the first person in the United States to be diagnosed with a confirmed case. And it quickly spread. In 2021, 500 Americans had died because of COVID and its variants. And by the 14th of June, the last time I can get really good data from the Centers of Disease Control, you can see the little graph, over 1 million people had died. 1,134,064 million Americans had died from it. And about a third of the population had contracted the disease. Again, this is all fact-based. It's not philosophies. It's not political bloviation. I just have been digging into facts. So when I asked myself, how did we get to these appalling statistics? And the truth is, the answer is one man, Donald Trump, and one party, the Republican Party. I'm sorry. I know that sounds like a partisan political statement or just, some sort of bias. But in fact, it's what is revealed when you look at multiple non-political surveys by recognized research organizations. It's really very marked. And why it started was because when COVID entered the country in Washington state in January 2020, the Trump administration and the president himself, it's clear they did not really comprehend what a pandemic represented or how to handle a worldwide medical emergency. They didn't have any plan. Now, I asked myself, how could they not have a plan? And the answer is that the protocols for a medical emergency had in fact been developed and had been given to them by the Obama administration, and they just simply ignored it because it came from Obama. And Trump wouldn't do anything that had to do with Obama. And the problem was further exacerbated because historically, when you really climb into this, you can remember back to that strange doctor who said Trump had wonderful health. What you find is that he has a very odd view of medicine and healthcare, and that you can remember his, the injection of Clorox and strange things to take. And I mean, all those odd press conferences he had. As Stat News, which is a reliable source, described it, this is a quote: President Trump's pursuit of anti-science policy has been so effective that as the first cases of COVID-19 were breaking out in Wuhan, China, a meaningful science policy infrastructure was in place to advise him, but he didn't use it. And as a consequence, America began this pandemic without a plan. But the other thing that really stands out for me is that the death rate between Republicans and Democrats is extraordinary. And it's because of misinformation. I've talked about this before, and I'm going to do a podcast, I think, entirely on this subject. But it's very clear that a large percentage of Americans, particularly conservative Republican Americans, became convinced not to get vaccinated. And as a result, when you look at the statistics, the death rate in Republican in the red states is much worse than the death rate in the Democrat blue states. So I don't know why the misinformation was developed. I don't know what the anti-vaxxer business was about, but it clearly was politically driven. And it's a tragedy, but it's more than that. It's a kind of social crime. Anyway, to stay focused on what I'm talking about today, the other thing that's turned up as I have dug into this stuff that nobody talks about, is how incredibly profitable this COVID-19 pandemic was for our illness profit system. And you've heard me reference this before. We don't have healthcare in the United States. We have an illness profit system, and it's basically designed to produce profit, not well-being. So when I first began to see this and see the actual numbers, I was appalled. Pfizer, Moderna, Johnson & Johnson, the other pharmaceutical companies capable of creating vaccines, clearly recognized the opportunity and lobbied Trump to do it. He may not have understood the medicine, but he surely understood the profit. Now, let's talk about some serious numbers here. Moderna's COVID-19 vaccine sales in 2021 hit 1.7 billion in vaccine revenue. And a year later, as reported in the Wall Street Journal, Moderna reported $17.7 billion in the sales of their COVID-19 vaccine. Spikevax for 2021 predicted it would generate at least $19 billion in vaccine sales for 2022. For Moderna, which didn't have any marketed products before the pandemic, the vaccine has been transformational, pushing the company to the top ranks of the biopharmaceutical industry. Price increases are particularly bad when it comes to medications. You probably know that. You look at if you have a prescription, you notice the price you pay. We pay more for our prescriptions than any other country in the developed world, by orders of magnitude in some cases. And it's a very special kind of market. And that, I think, is not recognized. You know, you don't have to buy a new car. You don't have to buy a new computer. But if you're a diabetic or depend on some other kind of medication to sustain your health, you do have to buy your medicine, because the alternative is either misery or death. And all the drug companies know this. That's why they constantly advertise their drugs on television. You know, if you spend an hour watching MSNBC or CNN or the Fox propaganda network and count the medical commercials, you'll discover a large part of the cable news business is supported by medical commercials. And the COVID pandemic presents a really strong example of this. Start with these two facts. The pharmaceutical companies took none of the risk to develop the vaccines from which they derive these profits, but they get all the profit. And it has been unbelievably profitable. Now, here's one you don't know. and that just I couldn't believe it. 9 new billionaires, billionaires, have been created from the profits coming out of the pharmaceutical industry's vaccines. Pfizer by itself hauled in $19 billion in COVID-19 vaccine revenue. By the end of 21, companies including Pfizer, Moderna, were profiting from a market that didn't even exist a year earlier. And combined, you ready for this one? 79 billion in combined global sales of COVID-19 vaccines and treatments in 2021. Nor in calculating the benefits financially does the money alone take into account the benefits these companies have received. There's also the issue of the prestige, the public profile of the companies, how, like Moderna, which barely launched as a biotech company, few people had even heard of it before 2020, and now you hear them and know about them in a way that only COVID could have made possible. Now, I also found, by the way, that there was one corporation, AstraZeneca, the second biggest seller in 2021, but the company pledged to sell the shot at cost in the pandemic emergency, and so they didn't make a lot of profit out of it. The company lost money on vaccine in the first half of that year and only turned a negligible profit subsequently. They're now, however, selling it at a profit in some markets. Drug costs worldwide are rising. That's just a reality that you know about if you have a prescription. From July of 21 to July of 22, the cost of more than 1,200 prescription drugs monitored by the United States Department of Health and Human Services exceeded the inflation rate of 8.5%. So while inflation is affecting customers at every turn, you know that when you pull into a gas station to fill up your tank and it costs $100, the pharmaceutical price increases are even worse. Now let me talk about another part of this that you don't hear anybody talking about. The profit bonanza involving not just the pharmaceutical industry, but the insurance industry is even more mind-boggling. Look at this chart. It tracks the insurance revenues. Do you notice how much the increase? 300% over the last decade for the insurance industry. According to research published in Healthcare Uncovered, the analysis of the 2022 financial statements of United Health Group, CVS, Aetna, Cigna, Elevance, Humana, Centene, and Molina enjoyed an explosive growth. It's unbelievable. And then there's the Medicare Advantage. You don't want to do this. It's marketed as if it's some kind of government program. It's not. It is a scheme to access profits, and it is heavily advertised, and you don't want to do it. The for-profits now control more than 80% of the national market and more than 70% of the Medicare Advantage market. In 2022, big insurance revenues, you aren't going to believe this number, reached $1.25 trillion. and profits soared to $69.3 billion. So to really appreciate what's going on, you've got to place these extraordinary profits in some kind of cultural context. So while the profits have been soaring for many hospitals, particularly in rural areas, and if you live in a rural area, you've probably experienced this, they're not profitable, these rural hospitals, and they're closing one after another, creating medical deserts where people who have a desperate need often for medical treatment have to drive 100, 200 miles. Based on research by the interinstitutional team led by Jane Boland, more than 20% of our nation's rural hospitals, or 430 hospitals across 43 states, are near collapse. Since 2010, 113 rural hospitals across the country have already closed. About 41% of rural hospitals nationally operate on a negative margin, meaning they lose more money than they earn from operations. Texas and Mississippi had the highest number of economically vulnerable facilities, according to the National Healthcare Finance Report in 2016, and these closures have had a devastating effect on healthcare in those states. Finally, consider that the latest drug spending trend report on pharmacy, the last data that I can find that I think reliable from Express Scripts Holding Company, showed that in 2015, 576,000 Americans had annual medication costs of $50,000 or greater. 576,000 Americans are paying more than $50,000 a year. It's a 63% increase in 2014 from 2013. It's unbelievable. 3 in 5 patients have medication costs of more than $100,000 a year. And this is particularly true of baby boomers born between 46 and 64, with men overrepresented at 56% of the group. This is a healthcare system whose primary purpose is not to foster well-being, but instead to milk you and me for money. It's all about profit. And the COVID pandemic has made that clearer than anything else you could imagine. We need to get universal birthright single-payer health care. That's what all the other developed countries in the world have got. We need to have a system which has an equitable distribution of medical facilities all over the country. You know, I was up between Stewart, British Columbia, and Hyder, Alaska. And it's very interesting. It's the only border where there's not a customs. Stewart is a Canadian town, very nice. They've got a library, a hospital, a school. It's a typical town in Canada, and it has all the facilities that you would need. It has access to good health care, good education, good resources. You cross the border, you go into Hyder, there's nothing. And that illustrates this more clearly than anything I can remember. It stood out for me so clearly when I made that trip between Stewart and Hyder. The difference was just stunning. We need to get single payer, birthright, universal health care. And it's only going to happen if you push your representative, senator, to get a national policy that was based on well-being and not profit. Everybody else can do it, so why can't we? It's going to depend on you and me pushing to make that happen. So think about how you could do that, how you could push, and put some time in. Be a volunteer. Let's make sure that our children do not have to live under the healthcare system we currently have. Thank you.